Mr. Fleece, let me ask you, you've built an enormous organization, Tampa Bay area, obviously the biggest part in Sarasota County, my colleague's district, but I've watched your growth, your professionalism. What is the key to your success? I think you're one of the top facilities, organizations in the country. And so as you look back in your tenure, and I remember about 20 years ago, you gave me a copy of your book, by the way. Time goes by so fast. But what's been the key to your success, or a couple of keys with your organization? It's one of the best run organizations in the country.
Thank you so much, Congressman, for that great question. And I, too, am extremely proud of Empath Health as we serve Central Florida, Southwest Florida, the East Coast of Florida, and as you stated, over 12,000 patients a day in our care. I think, number one, the secret of our success is always put the patient first to everything that we do. The staff are also mission critical, because if we are not investing in taking care of our staff, we will not have workers to care for ultimately the patients. As I have already stated, we understand within our industry that we as a country are in challenging economic budget times. It is critical that we look at this as a return on investment conversation. Hospice care has shown over and over and over again that it will ultimately reduce Medicare spending. 25% of the Medicare spend is spent in the last 6 months of Medicare beneficiaries' life. 25%. Of that 25%, 10 to 15%, a small component, is spent on hospice care. If we look at this as a return on investment conversation, there is so much that can be done around home-based care so that we are getting patients and families out of an institutional environment where they do not want to die, where they can be cared better for to reduce hospital readmissions, so that we can continue to expand care in the home.
You touched on performance to pay. I know, being in business 30 years before I got up here, that was a big premise of mine, is trying to make sure we tied the behavior to what we were trying to incentivize people. Can you explain what you mean by that from your perspective?
Yes, Mr. Chairman, Congressman Chairman. If you look at the current star rating system that is prevalent in Medicare today, it is one that does not adequately pay for performance the providers that are providing care for patients today. We would certainly advocate that for those organizations that have higher star ratings, that they get paid more under the reimbursement system. That would be one model of a pay for performance. We also stand proudly behind taking risk through our PACE programs for all-inclusive care for the elderly, where we are ultimately caring for those that would otherwise be in a nursing home and receive both the Medicaid and the Medicare component for our PACE programs. And we become responsible for that performance. We become responsible for making sure that they have the right care, right place, right time. And finally, Mr. Chairman, I would advocate that those that are not reporting their survey scores, to avoid scrutiny, be rooted out, because much of the fraud and much of the profiteering that we are seeing in America today, that we know the special focus program was proposed to address, are not submitting their survey scores. That is required so that those of us that are providing high quality care can continue to focus on our mission.
And my last question is on preventative care. That's really my focus with this committee as much as I can. Don't get sick in the first place. I mean, you get sick at some point, but my point is, you touched on that too, preventative care. What does that mean with your organization, with your patients, people that use your facilities?
Thank you, Mr. Chairman. So many of what we are talking about today is how we can improve outcomes for reduced cost. And ultimately, that will be part of what Congress faces in its upcoming budget discussions, I am sure. One of the concepts around thinking and delivering healthcare differently is the more that we focus on prevention, versus being reactive, and the more we focus on wellness versus sickness, there is a return on that investment. That will help balance this nation's budget.
Thank you.